Hello everyone, I'm Dr. Anupama Gangwal. I'm a senior consultant obstetrician and gynecologist at Cocoon Hospital, Jaipur, and I have a special interest in aesthetic gynecology as well as fetal medicine ultrasound. Postmenopausal bleeding, a bleeding from the vagina that comes at least after 1 year of not having had periods. That is 1 year after your final menstrual blood, and that is considered to be a sign in which you need to be alert. So the commonest cause of postmenopausal bleeding is atrophy in the lining of the uterus, that is endometrial atrophy. In the absence of the hormone, that is estrogen, the most important hormone in our body, the lining of the uterus becomes so thin that it tends to shed even by friction, and that may lead to postmenopausal bleeding. The other common cause is a fleshy growth in the lining of the uterus, or that we call as endometrial polyps. And yet another cause may be endometrial hyperplasia. That is a technical term in which tends to explain that in the presence of an hormonal imbalance, the lining grows haphazardly and it may become very thick, and then it tends to shed, and then there may be postmenopausal bleeding. But there is a serious condition attached to postmenopausal bleeding, and that is endometrial cancer, or what in lay terms we call cancer of the body of the uterus. And that is why I insist that all women who have had postmenopausal bleeding, even a stray episode, must meet a gynecologist and be thoroughly evaluated. So now a woman who comes to the office with complaints of postmenopausal bleeding needs a thorough evaluation. You begin with her history, a clinical exam, and very important is family history. Sometimes women may have a family history of certain conditions like the Lynch or the BRCA gene, and so family history, and then the tools that we use are the ultrasound, and a look inside the uterus is to what we call hysteroscopy. And then it is important to sample the endometrium, that is an endometrial biopsy, which is actually the the cornerstone of management of postmenopausal bleeding, as to it leads us to what may be the cause of postmenopausal bleeding. So now the treatment options for PMB is that depends on what is the cause. 9 times out of 10 it is just atrophy, atrophic endometrium, atrophic vaginitis, and if your ultrasound shows that the lining of the uterus is less than 4 millimeters, you can be quite confident that this may not be endometrial cancer. Yet a sampling is necessary. So after your biopsy reports have come, after your ultrasound has come, depending on what is the cause, if it is just atrophy, you may need a few estrogen supplements or just a careful wait and watch. If it is a polyp, we have to remove it hysteroscopically, and if at all it suggests an endometrial cancer, then depending on as to what extent it has spread, that is the stage of the condition, we will have to do surgery. We may need advanced chemos or radio. But remember that if an endometrial cancer is diagnosed very early in the condition, a surgery of removal of the uterus offers almost complete cure. So the sooner you visit for this complaint of PMB, the better you are.